Hi, welcome to another episode of Ask Dr. Jessica. This week we have on Tracy Zaslow. Tracy, tell us about yourself. What do you do and who are you?
Well, thanks so much for having me here. So I practice what's called primary care sports medicine, and what that is that I actually trained in general pediatrics first. So I learned how to take care of kids, and then went on to do a primary care sports medicine fellowship where I learned more about taking care of things like concussions, broken bones, sprains, strains, any sports related issue or concern. And so now I practice sports medicine and get to see patients with all those problems, and kind of have a specialty with that younger population, probably 30 and under, with a majority of my patients being about 5 to 20 years of age. So
It's fantastic. I think everyone listening can agree that sports are so important for kids, so helpful for kids for their, physicality, for their mental state. So it's really great work that you do. And you're a mother yourself, right? Can you tell us
yes,
about your kids? Are they in
yes,
sports?
yes, I have two young girls, almost 7 and 9, and yes, they're very active. Naturally, to a certain extent, they love to be outside and moving around, but they've been testing out lots of different sports. They're at the age where I think it's great to try a lot of sports. So we're definitely trying to garner the interest in finding a few sports that are of their favorites. And part of that is I want them to love sports for the health benefits, for the social benefits, and even for just kind of staying out of trouble as they get a little bit older and into the high school years. I'd love for them to have that connection with the health component and wanting the best for their body and making those good choices on their own as they get a little bit older.
And I'm just curious, how do you think parents should foster an interest in sports for children? Is it just exposing them to a variety of sports, or how would you advise that?
I think it comes from a lot of ways, actually. I mean, one of the number one things that research has shown is actually being a role model. So, as a parent, you don't necessarily have to play every sport, but engaging in your own physical activity really inspires kids to want to be involved in physical activity. So, I think that's one is the role model. Two is yes, lots of sampling, trying out different sports. Let them see, whether maybe they gravitate more towards something like soccer or basketball, team sport, more aggressive, or maybe they like something more individual like track or swimming. We're finding that with our own kids, that it's really interesting. Like one of our daughters is kind of leaning more towards that team sport and seems to love like kind of getting in the action of soccer, more kind of contact based, whereas the other one I think just loves being in the zone of swimming and track. It's kind of been what she's more attracted to. But just lots of different sports. It helps not only to find sports that they're really interested in, but develop different muscle strengths, different abilities. All the different studies have shown that kind of specializing in a single sport, picking one sport early before puberty, doesn't actually help your performance in that sport. That by doing many other sports, you get stronger and get movement patterns and things like that that will help you in all your sports careers.
That's so interesting because I always think about athletes like, Tiger Woods, where he started at 2 years old playing golf. And I always think to excel in a sport, you really have to find the sport at a young age. But that's great news that you're saying that's not the case.
Yeah, no, not at all. They did some studies back kind of when there was a lot of kind of training and behind the Iron Curtain, 40 years ago or so in Germany, where they would train these swimming athletes, and they found when they had the athletes do multiple sports, not just swimming, they did better at swimming. And we see that all around. Working with some of the professional teams that I work with, we had a soccer player who's a now professional soccer player, but he actually played a lot of volleyball as a kid. That was almost his bigger sport. And you could tell on the field because he would go up for headers and he just had height that was above and beyond everyone else because he had been training for volleyball where you need that jumping skill. And so it really does carry over from one sport to another where you can bring what you've learned, the skills that you've acquired.
That's amazing. So the benefit of cross training is really real.
Yes, yes, and it keeps it interesting too. So for kids, I think that's the other thing is really keeping it interesting and not making it necessarily too hardcore. You don't have to go and do a skills drill for soccer. You can just go out and like pretend you're kicking the ball, you get the hens in their pen, or different things like that at the younger ages. Really trying to just make it fun and make it interesting. And so whether that's with different sports or just different activities, I think those are all great ways to do it.
Now, curious, I'm wondering, as a general pediatrician myself, I've seen so many kids, for example, hurt themselves on trampolines, and I can't help but want my own children to avoid having a trampoline in our house because I've just seen so many injuries. Is there anything like that from your perspective where you've just seen so many reoccurring injuries from particular sports that you don't want your kids to participate?
Yeah, I mean, trampoline is one of them too for me. So my kids have begged me for a trampoline for years, and we've refrained just because the American Academy of Pediatrics doesn't support it. So I'm like, oh, I can't have it in my own house.
Really?
But sometimes I wonder if we're better to have it in our house because they go to their friend's house or their neighbor's house, and then they do it by the other people's rules rather than, well, if it was in our house, we'd be able to say, okay, only one kid per time. The netting is definitely intact. The springs are covered, things like that. Otherwise, other sports, I mean, making sure helmets are used for, any wheeled sports. So like, I don't say don't do scooters or bikes or things like that. But we definitely see a lot of scooter injuries. I think you hit a little crack and you go flying. And so you get a lot of fall on that kind of outstretched hand and lots of wrist injuries and such. So, just, kind of being careful with that, and being as safe as you can. And then everyone asks me the question about football.
Right.
Would you like to play football? Oh, I think it's really a risk benefit, in the sense that I think some kids are really drawn to it. And if it's their passion, then I think you weigh the risk and the benefit. Yes, there's more injuries in sports like football, hockey, lacrosse, not to pick on any sports in particular, but some of the injury rates are a little higher there. But we also see a lot of injuries in things like cheerleading or the overuse injuries of gymnastics and dance. And so I think, you pick your risk and you go with where the passion is. And then if you're within that sport, then you just have to play it as safely as you can. So as safely as you can means that you follow the rules, you're playing with good technique, you're not overdoing it. Those are all kind of guidelines to make it safe.
I think that's really good advice because I feel as a parent, I don't want to stand in the way of my child's passion. But let's say, for example, skateboarding. I see so many skateboarding injuries. So to your point, I might allow my child to skateboard, but make sure they're wearing a helmet, put on the wrist guards.
Yes.
Make sure they're taking proper precautions.
Yeah, I absolutely recommend the wrist guards because we have studies that show that they decrease the injury rate by about 50%. So, wrist guard, so helmet and wrist guards are my two absolutes for skateboarding. And then, if they're up for knee and elbow guards, that probably doesn't hurt either, but we don't have the research on that. And then doing it, as safe as possible in the sense of maybe trying to be at a skate park when it's not as crowded as other times, so that they're not having, run-ins with other athletes, and making sure they're not doing into the street. So that's another part where we've had some bad head injuries when they, have then kind of been hit by a car because they went on a ramp that landed them in the street. So just making good choices like that.
I think that's really good advice. I'm just thinking now, even with regards to a trampoline, maybe I should revisit it if my kids really want one and just make sure they have safety rules in place, as you mentioned.
Yeah, I mean, I think it's all about, how safe you approach it. And one other point kind of related to that sports component is just the idea of overuse injury. And I think sometimes families are confused by, what's too much for physical activity, in the sense we want every kid to be active every day. 60 minutes a day is really important every day, and it doesn't have to be all at once, but lots of little pieces. But there's also too much of a good thing. And there are some guidelines regarding overuse and too much activity, and it's based on age. And so the recommendation is not to do more of an hour a week of a specific sport training per year of age. So for example, for my 9-year-old, if she was doing gymnastics per se, she shouldn't be doing more than 9 hours of gymnastics training a week. It doesn't mean that she can't be doing other activities but it really shouldn't be that same repetitive activity, again and again, more than that hours per age.
That is a great guideline, because I think that question comes up a lot with parents where they want to involve their children in specific sports, but they don't want to overdo it. So along those same lines, in terms of injury prevention, is there any other advice that you can offer parents? For example, something that comes to mind, sleep and diet. Are there any studies that show that that these measures are important? I know they are, but anything?
Yes. No, but actually, sleep. We have a great study that was really interesting. It was just a survey based study, but they were asking kids about 7 or 8 questions. Then they asked them about how many hours a week they were participating in sports, and they asked them how many sports they were participating in. A few other questions, how long they'd been training, did they have a personal trainer, and then how many hours did they sleep? And of these questions, the only one that came out significant was the number of hours of sleep. And they found that kids who slept more than 8 hours, so more than 8 hours per night, had 50% less injury than those who slept less than 8 hours.
Wow.
So that's a really big difference. So in addition to that injury prevention component, sleep has also been shown to help with decision making as well as performance. They did a few studies where they had basketball players who were practicing free throw shots. And so they found that by just getting an extra hour or so of sleep a night, that they were able to improve their free throw accuracy significantly, like more than just like shooting. They had a placebo group and everything to compare. So it was really interesting. I mean, I joke, but I say our secret performance enhancement is sleep. So it's not all these medications or supplements or everything else. Sleep is the one that gets you the furthest.
That is it makes intuitive sense, but that's so interesting that there's actually been studies to prove that's the case.
So sleep is number one. And then, you mentioned nutrition. I think just maintaining healthy nutrition. There's no magic bullet for, drinking this or eating that that's going to make the big difference. But really just looking at having a healthy eating pattern, getting the nutrients you need. Some athletes, especially as you get into the middle school, high school range that are training very competitively, have trouble getting in enough calories to cover the amount of training that they're doing in addition to the growing that they're doing. And so that's one of the things to really look at, is just to make sure that they're getting enough calories to support their health and fitness. And one of the ways we sometimes see this play out in female athletes is if they're not getting enough nutrition after they've started their menstrual cycle, that their menstrual cycle can stop. And if that's occurring, that's a sign that they don't have enough nutrition, and that can give them long-term harm to bone health and things like that. So it's really important to pay attention to those signs. And it doesn't mean they have to stop their sport or stop their training necessarily. It's just to get that good nutrition so that they can continue to train in a healthy manner.
And what about those protein shakes and supplements? Is there any validity that may help? I mean, aside from the calorie addition to their diet, is there any evidence that may be helpful for athlete performance?
So this is where food is still number one. Food is your first choice for getting the calories you need, the nutrition you need, the vitamin and minerals you need. That's your food choices are number one. So instead of a protein shake, my first choice would be just have an extra piece of chicken with your meal, or have a peanut butter and apples as your snack. Just trying to get the protein in through the day. The supplements can play if they're not getting enough. So more that comes in with like maybe calcium and vitamin D. If they're someone who's avoiding dairy products, then maybe doing a supplement of calcium and vitamin D is really helpful. But the protein shakes, it's a complicated picture because they can be contaminated. They've done these studies that showed all the different contaminations of different like chromium and all these different agents. Even arsenic has been found in low levels in some of these, in some of the different protein shakes, and even regular name brand popular choices. So your best choice is to is to have food, and then kind of supplement as needed. And to me, if you're really considering something like a protein shake or what have you, then it may be a good time to meet with a dietitian. There's sports dietitians that can really go through and tell you exactly, well, how many calories do you need and what type of calories should you be taking in, and help with those choices and decisions.
And I agree with that. I think always it's a good, I generally feel like real food, you know what I mean by that is food that's grown from the ground, food that you can picture where it's coming from, I think is in general, the best dietary choice.
Yes, yeah.
Now,
Agreed.
okay, so we talked about sleep, we talked about diet in terms of injury prevention. What about stretching? Does stretching actually matter? Stretching before an activity or after an activity, does that make a difference in terms of injury prevention?
Yeah, so I would put stretching in the picture of warm up. So not just isolated stretching, but a warm up routine. So yes, it's great to not roll out of bed and go, right out there to sprint in a track meet. And so that warm up should be, dynamic in the sense of, doing a light jog, get the blood flow, get everything moving, and then doing more of dynamic stretching. So dynamic stretching, meaning that it's kind of movement. It's not a stretch where you just try to touch your toes and hold it for as long as you can. Just gentle movements to kind of loosen up the muscles. And spending 5, 10, 15 minutes at the beginning of a practice or before a game is really important to help to prevent injuries and give you your best performance as well.
What about cool down? Does a cool down stretch or light exercise after a vigorous sports play, does that make a difference in terms of injury prevention?
Yes, that probably plays a role, maybe a little bit less so in the sense, but or we have less data, maybe is what I should say with that. But yes, I think again, not going from 100 miles an hour to a dead stop is the main thing in the sense of going from a sprint to a walk is great before you just sit down. I think sometimes I'll see like high school athletes, they like sprint their mile as fast as they can and they fall to the floor and lay down. And so we'd rather have them go from that sprint to more of a casual walk, let that heart rate slow down more gradually. So that would be the kind of the key advice is just a more gradual process as you discontinue your activity. Going back to the warm-up, sorry, I thought afterwards that you mentioned. So going back to the warm-up was there's also it's a good time to do a set of exercises like working on your different core stabilities or biomechanics. So sometimes you can do a directed set of exercises depending on your sport that might help you to really wake up those specific muscles for your biomechanics. So again, I'll go to runners, for example. Runners really need to wake up the core muscles, the abs, the lower back and buttock muscles. And so doing some basic exercises that will use those muscles can then help them prepare to be able to perform better as they're out there training and competing.
So as you say that, I'm thinking I'm someone that does run 2 or 3 miles most days a week, and maybe because I never do those core warm-ups, maybe that explains why I've never been a good runner.
Well, I'm sure you're doing great there.
That's something I can blame it on.
You're a good role model for your kids. But yeah, I mean, I think it's great. Just as even as parents, it's great for us to cross train as well as our kids. So as a runner, it's good maybe a day or two of the week to integrate yoga or Pilates or even just some strength training workouts. All those things can be great whether you're 18 or 48, any age through there can be great to kind of integrate those different activities.
That sounds good. So maybe if I break my mile time after integrating some cross training, I'll let you know. I'll get back to you.
Totally, I want to hear about it. So.
Okay, so another question that comes up a lot, and I just want to more clarify this. When I was younger, I was always told that children should not weightlift, that weightlifting was dangerous and potentially harmful. And then in recent years, I've noticed more patients, more children be involved with weight training. Can you comment on weight training in children? Is it a bad idea? Is it helpful? Clarify this for families.
Yes, I think that's a great question. It comes up in our office all the time as well. And so, first of all, I always like to change it from the term weight training to strength training, because when you think of it as weight training, you're thinking about, oh, I want to max out my weight. Whereas when you think about strength training, it's building your muscle to get stronger. And so kids can absolutely do strength training. Strength training refers to using your body weight for exercise. It can be using weights as well. But there's a number of keys that are really important to remember. So can kids strength train? Absolutely. And it can be a really positive component. It's sometimes actually a great way for kids who are less active, like definitely those who might be a little bit more overweight and haven't been as fit. It's sometimes a really good way for them to start, because they can do some strength training, work on getting their muscles stronger, maybe even take off a few of the extra pounds, or just kind of become a little bit more lean, and then move on to something like running or more active sport that now they have better biomechanics because they have that strength. Strength training can be done safely if the exercises are done in a kind of following the correct technique. So by doing the exercises with correct technique, with supervision. So it's really important that especially younger kids have supervision. Some of the biggest injuries that we see are like a weight falling on a toe because maybe they tried to pick up too heavy of a weight, or they were being a little bit more haphazard with their movements of the weights. So following good technique, good supervision, and then not thinking about how much weight you're going for, but really thinking about doing the movement in the correct pattern and slowly building up the amount of weight that's being done.
I love hearing this, because I do know a lot of kids where they're not interested in, intense cardiovascular exercise, but they may be more inclined to exercise if it's, a lot of kids prefer strength training. So I think that's really good advice, because you said just being active and doing something is really the most important.
Yeah, and if they do strength training exercises going back to back to back, you can still get a great cardiovascular workout. And then, to me, I'm happy when kids are active. I don't care how they're getting there, as long as they're finding different ways that make them enjoy it and want to come back for more.
So let's say my 8-year-old wants to strength train. You're saying it's okay as long as he's supervised, he's not overdoing it, and it's relatively in a safe, in a supervised fashion.
Yes, exactly, and I think that means really starting out with kind of very light and minimal activity. So like, for example, doing a push-up, that's a strength training exercise. But as an 8-year-old who's never done a push-up, they probably are not going to do it with great form right off the bat. And so maybe it's that they start on their knees so that they develop the strength through the abs and lower back and arms. And then once they can do it with nice form on their knees, now you take them onto their feet and hands instead of knees and hands, and build up from there. Starting off with even sometimes, maybe they're doing like a bicep curl, but maybe they're just doing it without any weight at all. Make sure that they got the right form, and then you add the 1 pound weight, and then kind of slowly build it up. But really the focus on the form.
That's great. And do you find that most kids generally, that prevention makes a big difference?
Yeah, absolutely. I mean, in the sense of maybe I see it on the other side, is I see the kids who wandered into the weight room on their own and started to do lift their weights and get a finger stuck in the machine or drop it on a toe or what have you. Or that I guess when there's big group training sessions, if the coach or leader of that group isn't really watching the individuals so well, it's tough for these kids to get the form right the first time. And so sometimes we'll see injuries because maybe a pulled muscle here or there because they weren't doing the right form. But once we correct that, then we can go forward. And so I think it's really just about working on these things in really kind of small groups with attentive adults who is informed and can give the feedback on good form and technique.
Fantastic.